Hello and welcome to the 11th episode of the Connect the Dots NYC podcast. In case you're new, I'm your host, Vedant Vohra, and I couldn't be more thrilled to keep this momentum going as we explore bold, creative, and community-driven solutions to homelessness. As the creator of the CTD NYC app, I've seen firsthand how technology can build gaps, connecting unhoused individuals in New York City to food, shelter, healthcare, and more. It's a small but powerful example of what happens when innovation meets compassion. On this podcast, we go beyond headlines to highlight the people and ideas transforming how we think about homelessness, from frontline organizers to policymakers, service providers, and those with lived experience. Every conversation is a chance to reimagine what's possible, and today is no exception. Thank you for joining me today, and let's get started. Our guest today is Dr. Deborah Padgett. Dr. Padgett is a professor at the NYU Silver School of Social Work, McSilver Faculty Fellow, and internationally recognized expert on homelessness, mental health services, and qualitative and mixed methods of research. She's the author and co-author of numerous influential books, including Housing First, Ending Homelessness, Changing Systems, and Transforming Lives, and has conducted groundbreaking studies on homeless adults with co-occurring mental health and substance use disorders. Her work spans the US and global context, from New York City to Delhi, India, often focusing on how housing and social support can foster recovery and dignity. In addition to her research, Dr. Padgett has served on national and international advisory committees, helped shape the Grand Challenge to End Homelessness initiative, and mentored generations of scholars in social work and public health. Her career reflects a deep commitment to advancing evidence-based, human-centered approaches to ending homelessness. Welcome, Dr. Padgett. I'm so glad to have you here.
Thank you very much. It's great to be here.
I want to start with your early life and career origins. And so growing up, were there particular experiences or influences that sparked your interest in social issues, public health, or anthropology?
So I grew up in a small town in Western Kentucky, fairly conservative area. I I am a child of the '60s, so certainly I think that kind of openness to change and thinking through structural areas, institutions that are kind of messed up. At that time, it was the Vietnam War and civil rights, but today we're facing new threats. So I think I had some sense that there could be a better world out there, but I really had to leave my hometown, which I did. I go to visit, but I've been in New York for quite a while, and I'm happy to be here.
And you originally trained as an anthropologist before moving into your social work and public health. How has that background shaped the way you approach research and advocacy?
So yes, so I got my PhD in anthropology from the University of Wisconsin at Milwaukee, and I always wanted to go on a traditional academic track, but I soon found that positions in universities and colleges in anthropology were very few and far between. So I found myself teaching at a small college, Florida Southern College in Lakeland, Florida, but being rather dissatisfied, to say the least, that I was teaching a lot of classes, but not really getting to do research. And over time, I realized I hadn't really learned much about research in my anthropology PhD. I think I was supposed to do ethnography and kind of self teach, but I really felt something was missing. So, as often happens in these situations, an acquaintance of mine from my Milwaukee days was now at Columbia School of Nursing, Columbia University. And she was on a committee that offered postdoctoral fellowships in psychiatric epidemiology. And she said to me, Deborah, you're teaching all these courses. You're not, getting to do any research. Why don't you come up here and do a year as a postdoc? And I was thrilled to do it. I was afraid beyond words to come to New York City, but I love the idea of having an all paid education and a master's in public health as well. So I came here and I settled in, and I've really not left except for a lot of trips. But other than that, I consider New York my home.
Building off of that, you talked about moving to New York and connecting with that friend who was at the Columbia School of Nursing. And so your answer might be slightly similar, but would you consider that the kind of turning point that led you to
Yeah.
focus more as you went to New York City, focus more on homelessness and mental health as your primary area of work?
Oh, yeah, I think definitely I've had a few turning points, but one thing that comes to mind, I do have a background also somewhat in sociology, is there's a sociologist named Mark Granovetter who wrote an article called The Strength of Weak Ties. And at first I thought, what is that about? And then I realized he's talking about acquaintances that we have. They're not family, they're not close friends, but through some happenstance, they open doors for you. And that's what happened with my friend Lois. I didn't know her that well. She needed to fill this postdoc position, and it happened. And later on, I can explain how I got involved in Housing First in the same way, through kind of chance meetings with people and having common ground, in that area. So that was one of the turning points for sure, because when I was there at Columbia getting a master's in public health, as importantly, I was learning research. I was taking courses in biostatistics and epidemiology, and it really gave me a sense of how I could be more of an academic in the full sense of the word of doing research as well as teaching. So it was incredibly productive 2 years for me in my career, for sure.
And I want to focus I really want to focus into this research and specifically homelessness research. And so your early research in New York City focused on homeless adults with co-occurring mental and substance use disorders.
Mhm.
What drew you to that population specifically?
Okay, so while I was at Columbia, excuse me, this is in the mid-'80s, and there were two nationally very troubling public incidents going on, and particularly related to healthcare. It was AIDS. So to be in New York was to be kind of at ground zero of much of the discovery of the AIDS virus, but also just consciousness through research and public health that this was a serious problem in this country. The other serious problem was homelessness. And, I grew up, and most people my age grew up not ever seeing homelessness. There were impoverished people. But to think of someone sleeping on a sidewalk or in a doorway was just unimaginable, really. And all of a sudden, New York had hundreds of these people doing this. And so my colleagues at Columbia Public Health, some of them took an interest in that population and the fact that New York City's homeless shelters were filling rapidly and so forth. And I was really taken by that phenomenon going on and thinking, this is a place where I might work with colleagues who can help me learn more, but also possibly make a difference. I don't think I had a huge amount of social change in my system, but you could not ignore it. Let's put it that way. The problems that we were seeing in New York City and certainly in other cities throughout the US. So I really kind of pivoted towards homelessness and work with colleagues there, senior colleagues, on research, largely surveys in the shelters and that kind of work. But um, I ultimately did other kinds of research over time, but homelessness started then, and I was very fortunate to have colleagues and to have training where I could apply my newfound research skills and become more academically acceptable.
And looking back, what were some of the biggest challenges you faced when you first began conducting research with people experiencing homelessness?
Access, frankly. I was so naive as to think that I could call up someone in the Department of Homeless Services or even at a shelter and ask to interview people. And I quickly learned that's not the way New York City operates. And I had no business asking for entree. And to this day, researchers are not allowed into any of the facilities, and journalists, obviously, to protect the reputation, I guess, of the city. So obstacles of actually doing that kind of research were difficult. So initially, I was relying on survey data that had been given formal city approval of, and so I and my colleagues there published some articles about emergency room visits and substance use and some of the issues that homeless people were facing. The interest in people in particular, of what we call now the chronically homeless, that is people with um, serious mental illness, and most of whom were using substances. This is the era leading into crack cocaine, but also heroin, marijuana, and uh, anti-pain medications, that kind of thing. So those were the areas that I thought were the greatest need, and these were the people who we're seeing mostly in the shelters and for long periods of time, more likely to see these people on the streets. So it just felt more immediate. Little did I know at the time that many of the homeless were families, but they didn't live on the streets. So I guess there's some benefit there. They were placed in terrible places, but they were in shelters. So I kind of veered towards the chronically homeless because that met some of my own background interests in mental health, which I also worked through my MPH, was really on psychiatric epidemiology and uh, the rates of certain types of mental illnesses and all of the difficulties that individuals encounter. So that led me to that. I've done some work with families, but not so much. I'd say the thread from then until now has been people with serious mental illness and substance use among the homeless.
And how did your early findings on people with chronic homelessness influence your thinking about the intersection of housing, health, and recovery? Yeah.
So I was doing this research with colleagues there, and in an office nearby, a young psychologist named Sam Timberis was working on not a homelessness project. It was another AIDS related project. And we began to talk and kind of became casual friends. This is Granovetter's, weak ties make a difference, because a few years later, I was still doing this research, but I'd also veered off with colleagues to do some work in breast cancer interviews, that kind of thing. But Sam Timberis approached me a few years later and said he'd started this agency called Pathways to Housing. And after he left Psychiatric Institute, he became an outreach worker with the city. And his job was to go to the parks, go to the subways, do outreach with people who are clearly in the throes of mental illness, and try to convince them to go to Bellevue Hospital, which was a locked ward, which is not a very inviting place to go. He started Pathways to Housing, which was the beginning of, I'm sure we'll get to this, but of the growth of Housing First, which has been a phenomenal success. And he approached me several years later and said, "Would you be on the board of directors for this agency?" And I'm like, Pathways to Housing, it's interesting because it is about homelessness. That's my thing. But they're doing something that, at least on the surface, looked not really responsible, which is taking people who were using drugs, symptomatic, may or may not be taking their antipsychotic medications, and putting them immediately into apartments. But I trusted enough that Sam knew what he was doing that I would become a part. I was worried about a little bit about liability being on a board of directors. I confess at the time. But soon seeing was believing. And so it really helped me focus my interest not only on the so-called chronically homeless, people with mental illness and substance use, uh, but to focus in on Housing First and how this model seemed to be the one key to success with this population, of these individuals. Otherwise, they were making what's, this kind of continuum, this circular entryway traverse across jails, emergency rooms, hospitals, judge courts of law, and shelters. And that was a very kind of, to me, kind of heartless thing to do to homeless people, because no one was really offering them the help they needed. And so Pathways to Housing kind of cut that circuit short and provided housing first, and then provided all of the services that these individuals need. And there's no question that these are not people that immediately adjust right away. There's a lot of distrust that they've have a right to have because of the way the system's treated them, the police department, medical clinics, and so forth. Um, but it focused my attention much more on this phenomenon, and I was really grateful to have that chance encounter, basically, with Sam, and to really put my focus starting. It was kind of the late '90s. Pathways started in '92, but by the late '90s, I was really interested in Housing First and putting my efforts there. So that's my a little bit of my journey there.
Yeah, and let's get into housing first. And I was
Okay.
obviously lucky enough to interview Sam a couple episodes earlier.
Oh,
And
he's
anyone
amazing.
anyone watching this, please check that out. But one thing that Sam had mentioned is that he had co-authored "Housing First: Ending Homelessness, Changing Systems, and Transforming Lives," and that was a book that you had influence in. And so, for listeners who may not be familiar, how would you explain Housing First in the most simple, basic terms? I know you talked about it a little earlier, but what's that kind of like one sentence
Yeah.
concise summary of it?
Oh, one sentence. I don't know about one sentence. Yes, I was the lead author on that book because by this time, 2015, 2014, 15, um, it was clear that housing first was a thing, and that cities around the country in different places, people were coming from Europe. They would hear about it and just ask to accompany case managers as they went out to the apartments of these individuals. So housing first is quite simply what it sounds like, which is putting as a first priority getting someone into an apartment. And at that time, it was scatter site. That is, there are only so many apartments in a building that would be secured by Housing First for housing, that it would be a studio or one bedroom. But it includes much more than housing. It's not housing only. It involved a very intense availability of case managers, psychiatrists, nurses, and others to help meet their needs. And many of them were, after being on the streets, had a lot of physical problems. The medications might have led them to have diabetes and weight gain. And so there were a lot of issues that were needed to be addressed. So Housing First isn't just housing only. It's plus those 24/7 services to these individuals. And I think the biggest surprise is that they stayed housed. They didn't go back to the streets.
And one major thing that I learned from interviewing Sam and already from what you've said is the impact of Housing First has been huge. And so you joined Housing First, fairly early on. And how was it like to watch it evolve from an innovative pilot to a globally recognized approach?
I think a key to Housing First, unlike many of the interventions, not many, but a fair number. I'm in a school of social work, and I see all manner of mental health therapies, clinical work being taught. Housing First had that combination of the basic rudiments of you need a place to live, a place to lay your head, a kitchen where you can prepare meals and so forth. Um, so it was really unprecedented kind of level of engagement with those individuals. And as word got out, but I have to give credit to research here because Sam was not afraid to begin a study with the help from some federal grants at the time to actually see if Housing First worked. So this was in the late 90s that they were able to get enough funds to do a study. I was not involved with that study. I was just being on the board and just kind of watching it unfold. But it did follow the most rigorous design, which is random assignment. So they were able to get patients leaving the hospital, homeless patients with schizophrenia or other major serious mental illness, and some of them were randomly assigned to a shelter to treatment as usual, and then others were immediately put into housing and services. And they followed them for a period of years. But what they saw almost immediately, or at least after 1 year, is they were staying housed. Everyone predicted if you take someone who's abusing crack, who's addicted to alcohol or whatever, you put them in an apartment, they're going to destroy it. They're going to have all their friends over. They're going to get evicted, and it's going to make you look really bad. That did happen a few times, but overall, they changed and they became more invested in themselves and in their future. And I'm not saying it cured all their problems. By no means am I saying that. But in my own research, which came along later, we really, I'm a qualitative methodologist, trained as an anthropologist, so there's ethnography there. But also just in-depth interviews in general were my choice of methods. And you talk to people and you start to learn why they stopped being addicted or they managed to control their addiction. And a lot of it had to do with having a place to live and a lot to lose by letting their addiction go out of control. So the conservative voices were saying, no, this is your rewarding bad behavior. You're going to cost taxpayers money with disasters, with failure. And Sam's research, which is very unusual that the innovator studies him or herself, their program, but the findings were almost immediately, wait a year, and clear that the people in their own apartments were staying housed and they were leading more stabilized lives, taking their meds, less likely to be really addicted or out of control with substance use. The people in the no treatment or the treatment as usual group were still making that circuit of shelter, hospital room, being committed for a while, jail. A lot of people were put in jail for misdemeanors. So there was a striking difference between what Pathways to Housing was doing and what the shelter system of New York was doing. So I think that really, I'm not saying it became worldwide news, but word trickles out. There's only so many people involved in this kind of assistance. And it got to Europe. So people would be coming over from Amsterdam, Portugal, other places, say, show me this. I've heard about this unbelievable phenomenon of providing housing and actually seeing people's lives get better. And so word began to spread. And then, the research was backing it up. I think this is the key here. A lot of people have innovations, new kind of treatments or new ways to help people, but not that many of them have the evidence, which has since burgeoned into many studies of housing first. And the amazing thing is that the consistency of those outcomes favor the housing first subject, so to speak, in those experiments. The whole country of Canada, for example, did a housing first demonstration in 5 cities, $100+ million. And guess what? Again, it was 85, 90% of people were staying stably housed. It's not to say that their lives completely turned around. One of the things we really looked at was life course. And many of these people had grown up in extremely destabilized families. Substance use was often freely something you could do in these very poor neighborhoods. So they had a lot of trauma and a lot of problems in their background. And this is also the AIDS epidemic. So many of their peers had died of AIDS or were in prison. So it's not to say they didn't have things to overcome that wouldn't be overcome overnight, but the kind of the stabilizing force of having an apartment and having all those support services really produced really amazing findings. I still think about it today and with wonder, wow, this is something that works and really makes a difference. So yeah, I'm pretty much a convert, to say the least.
And I want to touch on a point that you ended by mentioning in terms of the difference between the success rate, so to speak, of housing first and just traditional shelters as they exist now. And I really want to focus that, and I want to see, could you explain like the fundamental difference between how housing first works and versus like shelters and more traditional ways of going about treating homelessness?
Yeah, so let me start by saying that New York City is the only city in this country that has a legal right to shelter. There are other cities that do it in the wintertime or something, but New York, it's 365 days a year. If someone needs a shelter bed, New York legally has to provide that. So for that and how many other reasons that it seemed logical. I mean, many people in the 90s thought this is a phase. The homelessness will gradually recede, the economy will get better, and we won't have to deal with this anymore. But to the contrary, homelessness persisted and got worse in many cases, even as the economy was improving for so many others. So many people were being left behind. But back to the shelter option. So New York City did legally, and that may have fed some of that movement towards what I call building a shelter industry, which means that we now have hundreds of shelters around the city. Some of them are run by nonprofits who contract with the city. The city's budget for homelessness is over $4 billion a year. A lot of that is from the state Office of Mental Health, particularly for people with serious mental illness. So let me say the non-pathways model is to go into a shelter. It's called treatment first. You go into a shelter, and then hopefully a case manager will work with you, and you'll find someone, and you will start the paperwork so that you can go to the step 2 of the ladder, up to permanent housing. Step 2 is you will go to a less restrictive, possibly a smaller safe haven type setting, or what we call permanent supportive housing, PSH. And that's for people who have a disability by and large. Could be a physical disability or a psychiatric disability. So that ladder, or that staircase as we call it, meant that a person would start in a shelter, and it might take years before they ever get to the point where they can actually find a place of their own. Many of these people with disabilities did have disability income. It's called SSI. It's nowhere near enough to live off of, much less pay rent, but it was some amount of money. Meanwhile, Pathways to Housing was growing. They soon realized that they need to separate housing from services. So they had a housing department that just worked with landlords, and that was really important, is to work with landlords so that they wouldn't evict the Pathways to Housing clients, and help them by carrying out some of the activities that maybe the landlord was supposed to do, helping paint a room or whatever. But the picture for these individuals was generally pretty good, because landlords could call Pathways and say, so and so is doing this. So gradually over time, New York City became the city of shelters. And by that, I mean mushrooming growth of sometimes rented from private landlords at what I would call outrageous rates, $4,000 a month, sorry, for an old broken down motel room out by the airport. And that would be for a family to live in. But it was a system that required a lot of money to maintain. And so the budget for homelessness grew and grew. And almost all of that money went into the shelter industry, as I call it. I mean, you can imagine there's thousands of people that work in these agencies, thousands of different jobs that need to be filled when you have people who need 3 meals a day and might have a cot to sleep on at night. So New York kind of went down that path. So Pathways to Housing was this little island, basically, in what was a sea of shelters. I guess I would put it that way. And gradually it was getting attention in Canada and elsewhere in other parts of the country. But in New York City, it did not catch on. It thrived in its own way until it ultimately it was closed in 2014. But the city itself was so attached to this no turning back. They had 20-year leases on buildings as shelters. So, it's expensive. And they legally had to have a shelter bed. So the difference was really even becoming more obvious, that Pathways to Housing was not the staircase, not the whole procession up, with rarely did a person actually get into their own apartment. But permanent supportive housing is grown phenomenally. And that may or may not be housing first linked. There's plenty of PSH, as we call it, where they have to live with roommates, and they have, drug testing, and they have to give all of their disability income to the program, and where they're kind of kept under lock and key, more or less. So those, that's kind of what the options are. And then you had Pathways, where they had their own apartment, and they got to say, I don't want to take my medications, and not lose their apartment. Or I still need cocaine and not lose their apartment. That's not to say that Pathways didn't try to work with them to get past that and to get over that need. And I would argue that many of them did, um, through a slow but definite kind of awareness that they had more to lose and they should give it up. So you had this very stark contrast here in New York. And to this day, New York City is a huge shelter system. Most of our homeless people live in shelters. Are they desirable places to live? I don't think anyone would argue no. And that's why people end up on the street. And the people we interviewed on the street later on, I didn't just interview in these apartments. They would all say, I've been in the shelter. It's not safe. Everything gets stolen. And then of course, during, the pandemic, it was even more dangerous. So it was a very, unpleasant situation all around. And yet New York City could not break itself away from this shelter model.
Well, one thing that has differentiated housing first is the kind of proof of concept that it has been based off of. The research that's been conducted and the over 80% housing success rate that it's been able to boast. That's really what it's been able to differentiate, and at least what I believe is what's helped it gain such popularity. And so you've served on national and international advisory bodies focused on homelessness policy. What lessons have you learned about getting research to actually influence systems and policy change?
That's a really good and it's a difficult question to answer, I have to admit. I will always think it was the very rigorous research that kept producing the same successes that kind of weighed into people's decisions. And other cities were adopting it. If not the whole city, there would be programs. And after a while, HUD, Department of Housing and Urban Development, endorsed Housing First. And it's been that way for 20 years or so. Of course, now, and I won't go down that road because you won't be able to stop me, but now we're facing, a full on attack of Housing First. But the structural aspects are what I think prevent even Housing First from completely changing society, more to that point. Because first of all, there's racism baked in to homelessness in this country. And there are institutions that stand to lose money if Housing First comes into place. Um, city-run shelters, these nonprofits. One of the things about some of the nonprofits that made me uncomfortable is, we visited them. I had grants and I had comparison groups. I didn't do a trial. But some of them were just one step above, like jails or, internment places where they did inspections all the time and really kept people in place for long periods and inspected and so forth. But I think the structural factors were providing more incentives for that kind of approach, to put it that way. But there's also, and I'll say some of these are faith-based organizations, and then there are people who just have a moral sense that there's something fundamentally wrong with an approach that appears to enable use of drugs and alcohol. I would argue it doesn't. It's called harm reduction. It helps actually reduce the harm and ultimately, I would argue, help people completely overcome their addiction. We've seen that time and again. But there are, in play so many nonprofits, so many governments, and then there are moralistic people out there, increasingly wealthy people who are using this argument. And it goes down well in many parts of the country that we're using money, hard-earned taxpayers' money, by giving people, an easy place to stay. So it's really hard to change those sort of incentive systems to keep things going as they are. But, I say that and then I say, but we have examples like Milwaukee or Houston. There are nice videos on YouTube and elsewhere on how they just said, we're going to do Housing First. And we're going to get everybody on board. the police, the court system, the parks department, the shelter providers, everybody that has something to do with homelessness, and try to find some way to get them into housing and end their homelessness rather than just throw them back into this cycle, this institutional circuit, as it's called. California almost, I would say, took the opposite point of view. I co-wrote an article with my former student, Ben Hinwood, about this. They crowded people into Skid Row. They were like, oh, homelessness, this is a problem, but downtown doesn't have much going on. So we'll just have 50 square blocks and put them in there. And we'll put some programs to help them get clean and sober and to get on food stamps or whatever. But they'll live in tents and it'll be kind of squalor, but nobody goes downtown, so they won't notice. Well, the problem with homelessness just increased the numbers of people, and downtown became popular and real estate became valuable. And so now California is facing not many shelters at all. And of course, they're blessed with enough good weather that people can camp out. But we all know that that's produced a phenomenal problem in California of people who are living out of doors with no place to go. I'm not exactly advocating for more shelters, by the way, but they're really in a different kind of quandary. We have an embarrassment of riches when it comes to shelters and nonprofit organizations, but the money's, in my opinion, not well spent. Whereas there, they've got to raise capital funds, and they're trying their best to do things like with tiny homes and rapid rehousing, try to catch people on the verge of eviction and help them turn the corner and stay housed. But yeah, I tend to be sometimes a little oversimplified even in my own mind about this, but there are developers, and these are people, these are these big companies, BlackRock and others. Some of them are LLCs that stand to make a lot of money from building residential properties. And we lost all the SROs. We lost a lot of the low income places where people could live and have a somewhat decent place to live. Those places were gone. They were replaced, urban renewal and others, by, fancy high rises and residential developments. And out west, they have, single family zoning laws. So you can't even build up, so you really have a finite amount of space available for people. So the population grows. More people are thrown into homelessness because there's not enough housing. And that is the bottom line. The problem of not enough housing, to me, is a structural problem that, for many reasons, it started under Reagan, but this country has chosen to try to kind of look the other way and hope that somehow people will lift themselves up by their bootstraps and find a place to live. There just simply isn't enough housing because the federal government got out of that business. We still have public housing, but no new public housing. And rental vouchers, Reagan cut back on rental vouchers, which is a way to, live in private dwellings, for which the rent is paid to the landlord by federal monies.
I want to focus on one thing that you talked about, this kind of unifying aspect that was existing within Milwaukee and Houston. And, you talked about the very, nice YouTube videos that are online, and how really when everyone comes together and really just believes about housing first and just trying to solve this, issue at its core and getting people into housing, it really does work. Now, something that you've written about and slightly talked about in this podcast, as well as the role of race and racism in the homelessness crisis, and how it does make it a little bit hard to unify when you have so many different cracks in the homelessness crisis, and only one of them is actually housing. You also have, racism and people with different backgrounds, and some people are incarcerated, some people have substance abuse. And so how do you think systems can better address these inequities that exist within homelessness?
Well, we have a long way to go. This country owes a huge debt to the African American population for not being allowed to participate in the incredible wealth generated by this country after World War II, the economic growth, the boom in housing. Veterans were coming home. African American soldiers weren't even able to get the VA, the help with housing. It was phenomenally racist. And so if an African American family can afford it but are not allowed to buy a house, home owning is the one way wealth is generated across this country. But if you can't own a home and you're increasingly forced into slum type areas of paying too much rent, you don't generate any kind of assets, for the next generation or even for your own life. So that is a very, to me, it gets me very upset because it's just blatant racism. It's why something like 40% of all homeless, I need to check that, but it's about 40% are African American. It's only 11% of the population. So the disproportionality speaks volumes, and it's volumes about how they've been exclusively kept away from housing developments and from the ability to accumulate capital and to have the same wealth that white families do, which is 10 times more than African American families on average, the amount of assets and wealth. So you take that approach and look at homelessness, and therefore you see more African Americans homeless. And then to the extent that racism is still in our society, it's harder to get them housed. Landlords often discriminate. They're not supposed to. And to some extent it gets perpetuated. And that is, I think race is one of the driving forces behind homelessness in this country, and our inability to put an end to it. Some of it's having to do with race. And then, as I said, the whole structure of our system of free enterprise, as it's called, is to build wealth, and increasingly, unlike the European countries, expend fewer public dollars on healthcare or housing, basic things that people in Western Europe take for granted, or Canada, we do not have. And it's an embarrassment to me to be an American on many occasions, because I know that our institutions perpetuate this kind of inequality. And as much as is spent, billions every year, on homelessness, it doesn't bring much fundamental change in ending it.
And I always like to end these podcasts by kind of looking forward. And so the next couple of questions will fall under that category. My first one is, if you could see one major cultural or policy shift happen tomorrow or very recently to address homelessness, what would it be and why?
Well, we are literally in the midst of the enactment under the Trump administration. They have actually said, housing first, we've got to end, and these are billionaires with their institutes, Cicero Institute being among, insisting that we've got to put people in internment camps and, make them get rehab or detox and so forth. I think if there was one thing, I'm sad to say it, but I'd like to go back to those days when HUD was pushing housing first, and the VA, the Veterans Administration, ended veteran homelessness like by half, cut it in half, using housing first. So we were kind of in a good trajectory. But again, without some fundamental changes, it's not going to go away overnight. So I guess the change would be a return to more public support for housing first. And there's a few things that could be done. More rental vouchers, right? Reagan cut those back so much, but that would keep family homelessness. It would end family homelessness if we had Section 8 or housing choice vouchers. So it probably costs less to actually do these things than what we're spending now in shelters and jail cells and emergency room visits and so forth. So I guess I hate to say it, I'd like to return to. It's not like we were coming to an actual, end of all homelessness. Far from it, and the western part of the country is really, struggling with this. But we're at the opposite now. The Supreme Court said it's okay to arrest people for being homeless. I mean, this has all happened in the past year. So we've really gone backwards through Supreme Court decisions and the current administration.
And for students, early career researchers, or community advocates listening, what advice would you give for building a career that bridges research and real world impact?
Well, I think that's a good question. I mean, there's certain disciplines that you go in, social work being one of them, public health being another, where it's more possible to attune yourself to deprivation and need and go in that direction. But I also want to say that one of the more successful efforts, and I'm actually wearing the T-shirt. It's human.nyc. It was two business school students, graduates at NYU from Stern School of Business, and they, in a kind of entrepreneurial way, but they went around and interviewed homeless people, and they really put together some incredible public interest. I guess I would say mainly through their website. Uh, Helping people understand what it took to end homelessness and how people got in that position. But I mean, there's some disciplines where there's more room and more growth possible to take on issues such as this. But I would argue anyone who's concerned, there's plenty of areas to help out. I mean, for years I worked at a soup kitchen. This is before Pathways to Housing and so forth. And I was glad to be able to do that every Saturday, but structural change, institutional change, even institutional accountability. I think we just let developers do what they want and still reap all those tax rewards, tax evade. So if there was more institutional accountability, I think we could have a lot more of what I would consider more common sense humanitarian ways of dealing with this. It's not going away. If anything, under the current system, we're going to see a lot more homeless people. And that's really a sad thought.
Okay, well, thank you so much, Dr. Deborah Padgett, for your time, your
Mhm.
experience, and your knowledge. I really appreciate you coming on this
Thank
podcast.
you. Thank you for allowing me to come on.
Thank you so much. Okay, well,